I almost said good morning. Good afternoon, everyone. Welcome to today's Healthy Eating Active Living Work Group meeting. I want to thank you all for your participation today. I'm going to go ahead and share my screen so we can all see our presentation for today. Awesome. I can't believe it is October. That is wild. But thank you all so much for being here with us today. I do want to remind everyone that this meeting will be recorded. We do this just for note taking and for reference if any time we need to come back to this meeting or if a partner misses the meeting and needs to see it. So we just thank you all for just being with us today. We do have a short icebreaker, and because our agenda is a little packed today, I'm going to ask that we participate in our icebreaker in the chat box. So at this time, if you could include your name, your organization, and your response to the question or finish the sentence of the day. My favorite autumn activity is. So the fall has officially started, I think a week ago, maybe a week and a half ago. And I think next week, if the weather people are correct, it's going to start cooling off a little bit. I think I saw some 60-degree weather, some rain. So I think it's time to pull out those long sleeve shirts and sweaters and coffee and hot tea and hot cocoa, whatever your warm drink of choice is. So your name, your organization, and your favorite autumn activity. And I'll give everyone a minute or two to include that in the chat box today. We'll also use this as attendance as well. I see Heather. Her favorite activity is decorating her house for Halloween in the fall. I love that. Brian, your favorite activity is hiking. Perfect weather for that. And Taylor, you're learning to crochet. We might have to do a lunchtime crochet session. That would be cool.
I love it.
Yeah. Devin, favorite fall activity is drinking coffee and tea by the bonfire. That is a great one. Rodney, we see you here today. Thank you for joining us. Awesome, awesome. Okay, well, thank you all for participating. Tanya says she loves bundling up in the house with a warm drink in front of the TV. Yes, I'm looking forward to that this evening. Anything horror related? Okay, Jessica. There's some good movies out right now. More to come. So may see you at the movie theater. Well, thank you all so much for participating, and please continue to write your name, your organization, and you can finish the sentence as well. We're going to go ahead and move on, and I'm going to ask Devin to provide us with a review of the meeting agenda, and then we'll review the work group vision as well. Devin?
Sure. Hi, everyone. I was about to say good morning too. Good afternoon. Just quickly going over the meeting agenda, just as we're doing now, our welcomes, our introductions, and we are going to go over our work group vision here just in a second. And then we will have the American Heart Association, AHA, talk about their DC Walk presentation, and that will be Heather Forrester here. We will also go over the SB 151 Health and Wellness Work Group update. And then we'll have our community announcements, and then we'll talk about any notes for the next meeting and our adjournment. And share just really quickly our vision. The Healthy Eating Active Living Heal Work Group envisions Prince George's County as a place where everyone has access to fresh, nutritious food and environments that promote good health, wellness, and active living.
Awesome.
So with that, I'll pass it back to Sinead. Mm-hmm.
Thank you so much. I'm now going to ask our co-chair, Jessica, to introduce our guest speaker for today.
Awesome. Thank you, Sinead. And I apologize, guys, for not being on camera. I'm actually in the car, but I actually will be able to get on camera in about 10 minutes. But I want to introduce my colleague, Heather Forrester. So Heather, I will not bore. Well, look, I'm driving, so I am not going to read, so everybody can read the bio. But I will just say that Heather has recently joined our team, and she is amazing. She's actually leading she has a unique position because she's actually going to be leading two events for us. Today, we're going to be talking about our premier event, which is our largest event, which is our DC Heart Walk, which is coming up on November the 1st. But then she's also going to be leading our Lawyers Have Heart event, which we will talk about. I'm gonna pre-invite you, Heather, like probably sometime in April, because that event takes place in May. So that's another great event that we have coming up. And that's a spring event. So I know we'll say spring seems like far away, but we all know that that comes up before we know it. But today we're going to be talking about our Heart Walk, which takes place at the National Mall. I think a lot of people probably have heard of it, if not participated on it. But we wanted to I'm going to give Heather the floor so she can talk more about it, and hopefully would love to see just a lot more community teams, and get more Prince George's County, as the co-chair of the HEAL committee, would love to see more of the county and more of, representatives to come out to the mall and just be part of the walk this year. So Heather, I will turn it over to you to talk about the walk. And like I said, hopefully we'll get to see everybody come out for the November 1st. So take it away, Heather.
Thanks, Jessica. Yeah, I'm really excited to be here. I love working with Jessica. We have a great time. But yeah, she invited me and said this would be a good place to come speak about the upcoming Heart Walk. Like she said, I'm Heather Forrester. I'm one of our development directors here with the American Heart Association, and I do support the Heart Walk. And specifically, I also am supporting the community teams of the Heart Walk. We have companies and we also have different organizations that join as community teams, and I support both of those. This year, like Jessica said, the Heart Walk is going to be on November 1st at the National Mall. It's at the National Mall every year. For those of you who might be a little bit unfamiliar with American Heart Association or Heart Walk organization made our mission over the years. It's focused on improving people's lives in the community, and that is directly attributable to organizations like you and people like you who join and support. Heart Walk, like Jessica said, it's our region's largest community event. Each fall, we have thousands of walkers and companies and families come together on the National Mall, and we celebrate survivors and we honor those we've lost. And we raise funds to drive the life-saving research and community programs. This year, our Greater Washington Region goal is 2.2 million. And partners like you are such a big part of making that happen. And we know Prince George's County is facing some of the highest rates of obesity and chronic disease in the state of Maryland, which is exactly why I think this working group is so important, and why I think that the Heart Walk would fit naturally alongside the work you guys are already doing. At the end of the day, we're both focused on the same thing, creating a community where health and wellness are something that's accessible to everybody. So yeah, next slide. So unfortunately, cardiovascular disease does remain the #1 killer of Americans. Each year, around 350,000 people experience sudden cardiac arrest, and sadly, bystander CPR is performed less than half the time. I don't know if you have any football fans here, but many of you might remember Damar Hamlin, who collapsed on the football field. This was a few years ago during a game, and his life was saved because CPR was started immediately. I mean, he has access, obviously, to really amazing healthcare right there. Most people are not going to be able to receive that kind of rapid response. And that's why the AHA is working to transform us from a nation of bystanders into a nation of lifesavers. Not sure if everyone knows this, but right now, in the United States, CPR, attempts at resuscitation, are done less than half of the time. 65% of people when polled say they don't feel comfortable or wouldn't feel comfortable stepping in to help in the event of a cardiac emergency, and that's something we really want to change. And then beyond CPR, the dollars that we're raising through Heart Walk also help fuel research that can lead to life-saving breakthroughs. Not sure if everyone knows, but AHA has brought us things like the first implantable pacemaker that was supported by American Heart Association, first artificial heart valve, amazing advances in neonatal care with congenital heart defects. So when people sign up to do things like the Heart Walk, donate, or just simply share this information, you're helping. You're not just helping in the moment of cardiac emergency, you can also help with the next medical breakthrough that's on the horizon. Next slide. So a little bit about event day. Like Jessica said, I'm not sure how many of you have participated in Heart Walk before, but it's really fun. Every year we see about 5,000 participants coming from around 80 organizations plus community members. Last year's Heart Walk raised about 2 million. The event is on the National Mall. It's at 7th Street Northwest between Madison and Jefferson. I don't know if you guys know that area, but you really can't miss it. It's a huge festival area. And this is a little bit of the schedule for the day. So 8:30 a.m. we would say like doors open. That's when everything starts. There's going to be a lot of fun activities there at the open, CPR demos. There's a pet zone for those of you who may not want to leave your pets alone or your dog alone for the day. A kid zone. I'm bringing my 8-year-old. It's very kid friendly. There's going to be face painters and like a basketball hoop for the kids to play with. And then at 9:30, we have a quick program and warm up, and the walk actually starts at 10 a.m. And there's two options. You can do the 1 or 3 mile route. You don't need to choose when you sign up for registration. Just do whatever is feeling right for you that morning. And then we also have a community teams tent that will be there. That's going to be for organizations like your working group, DC Stroke Collaborative, all of our community teams that come out. That will be like a nice home base if you do decide you want to join up. We'll also have something called the Top Walker Tent, which is for any individual who raises $1,000 or more. It's a really nice deal. You get a hot breakfast, there's a parking space. So if you do decide you want to participate in Heart Walk and fundraise, definitely would recommend aiming for the Top Walker status. Next slide. So if you are interested in signing up, what would you do? Decide you want to be a coach? Well, here's what it would look like in simple terms. So first, you would want to register your team. It is completely free. It takes like a minute. It's very quick. And then you'd want to set a goal. It's different team per team depending on the size of the goal. We would recommend usually around $2,500. Obviously, depending on the size, it might be less, might be more. But you can choose whatever feels right for you. Then you want to recruit walkers, so colleagues, family, friend, neighbors, anyone in your circle who you think might be interested or connected to the mission. I have roped my husband and daughter into joining my team, so that's always a good place to start. And then as a coach, you want to encourage your team. You want to keep energy up, celebrate when you're hitting milestones, first $50 raised, and then help everyone personalize their Heart Walk HQ page, which we'll talk about in a minute. And last of all, have fun. This is really meant to be fun. This is not meant to be, we have stressful enough lives. We want this to be a fun event and not something that's putting a lot of pressure on people. So yeah, like I said, you can use your Heart Walk HQ to pull reports, send team messages, track progress. You want to set a team goal early. We have about a month now. So today's October 1st. It's perfect timing. 1 month of runway to get recruitment and fundraising going. And then as a coach, you want to stay connected with your top walkers. Make sure that they're feeling supported and can help and rally other people. Next slide. So let's say you don't want to be a coach, but you want to walk. You definitely want to participate and be a walker. So walkers, along with the team coaches, are really the foundation of the Heart Walk. Without walkers, there is no movement. So your role really matters. The first step, just as with a coach, is you want to register to join a team. And you can either join an established team. So if you guys decide as a working group, you want to create your own community team, you can do that. You could also register as something called a solo strider. That's just an individual who wants to walk on their own and fundraise on their own. Either in any case, you will get access to the Heart Walk HQ in the app. You want to set a personal goal. So we talked about team goals. You also want to set a personal goal. $250 is about on average what individuals are raising here in this area. So that's a great starting point. But the most important thing is to participate. And then invite others. Think of 2 to 3 family, friends, coworkers you can bring along. That's how we can get our teams to grow. Lead by example. I think it's always a good idea to start by making a personal gift. Doesn't have to be a big amount, but it helps to kickstart your fundraising. And it's kind of like, we're practicing what we're preaching here. And then use email, social media, Facebook fundraiser to invite others. That's honestly how I've been doing fundraising for my team. My mother-in-law tried to get her to join my team. She's like, I'm not driving out to DC that day, but I am very happy to give. And she donated through my Facebook link to my team page. And then last of all, celebrate. This is about honoring survivors, remembering our loved ones we've lost, and walking together as a community. So that is really the most important part. Next slide. So Heart Walk HQ, this is what I mentioned already. When you get registered for the Heart Walk, you will get access to this, which is the Heart Walk HQ. And this is kind of your personal fundraising dashboard. It only takes a few minutes. You can personalize it, and we do recommend that you personalize it by uploading a photo of yourself if you're comfortable, your team, a loved one that might be connected to the mission. And then you can add a short message about why you're walking. Like, why does this matter to you? Why is this important to you? And we have found that people are much more likely to donate when they see a personal story. They feel more engaged. You can also upload a video link or link one from YouTube, also an option, and that's a great way to make your page feel inspiring. And then the Heart Walk HQ can track your personal progress, and then your team's progress. So you'll kind of see where you're standing. You can see here, like, dollars raised, team members recruited, etc. And then, of course, here on the right, you can see the Facebook fundraising. This is really cool. It connects directly from your HQ. And then with one click, you can invite friends, share updates, and donations raised on Facebook automatically count towards your goal. So it's a really nice, easy way to get things moving. And then finally, it's just a powerful tool. It makes it easy to share your story, recruit walkers, and raise funds with just a few clicks. So this, honestly, the easiest way. Next. Heart Walk app. This is really cool, and another really easy way to help stay connected and raise support is using this app. It makes things super easy. You can invite your friends and family to join your team. You can send pre-written text messages out. You can even deposit checks. So if someone's like, I would love to give, but I just have my checkbook. You can use the app to deposit checks. And we have found that participants who do use the app raise on average about 3 times more than those who don't. So that's a really powerful tool to be using. And it is completely free to download. You can, if you have an iPhone or Android, either one works, only takes a minute. And then once your team is registered, the app is a really easy way to recruit walkers and to fundraise. And really exciting, you can put it to work right away because we have something called the Move More Challenge, which is starting this Friday on October 3rd. I know it says October 4th there. That's a mistake. Apologies. It's actually October 3rd. And it's a 30-day push to get active, track movement in the app, and build momentum leading into walk day. So the challenge is a great way that I think can bring your group's vision to life. A good way to encourage residents to build sustainable, healthy habits through daily activity, whether that's walking, dancing, household chores even. And you can link your fitness device if you have an Apple Watch or if you have a Fitbit, and it will automatically upload your movement, or you can just put it in there there's like a little plus button that will let you add activities of different points for each. Okay, next slide. So rewards, besides just the joy of participating and doing something and being part of an amazing mission, for our coaches, we have specific rewards. We want to recognize your leadership. So to thank you, these are some of the exclusive rewards you can earn as your team reaches fundraising milestones. You'll see here at $1,000, there's a t-shirt, $2,500, a coach hat, $5,000, a very nice coach crew neck sweatshirt. As we all just were talking about the fall and the chilly weather, that would be really nice to throw on. And these really aren't just about swag. It's a way of celebrating the impact you're making by rallying your community around heart and stroke health. And remember, walkers also receive awards based on their own fundraising, so everyone has the chance to be recognized. And if any of you are interested in serving as coaches, I am happy to work with you one-on-one to get started and make sure you have everything you need. Next up. Top walker incentives. So besides coaches, like I mentioned this, I think a couple slides back, but those walkers who are raising $1,000 or more achieve what we call top walker status, and you get some really nice perks with that. Like I said, there's a tent that's specifically for top walkers, sometimes called the VIP tent. And in there you get hot breakfast, and there's other goodies and swag specifically for our top walkers. Like I said, you get the parking pass for the day of, which I think is really nice. And then we also have another status if you reach $5,000 or more of fundraising called Executives with Heart. You don't actually need to be a CEO or an executive. It's just the name of that group of people. And if you reach that status, it's another really great incentive because you get invited to exclusive networking events and you get your headshot on the executive row at the Heart Walk, which is really nice recognition. Next up, we have our CPR demo. So let's see, Shanae, let's see if this works for us. So let me pause quick just to intro it, but September 10th was our official Nation of Lifesavers Day. So this was a big push across the entire region to get people registered and to watch this video we're going to see right now, showing hands-only CPR. The goal was really to spread it as far as possible, encouraging people to share it with friends and family and colleagues. We're going to watch it now. And even though September 10th is far behind us, it's not too late to join in. After we watch the video, I'll tell you how we can share with friends and family and be a part of turning us into a nation of lifesavers. Okay, thanks, Sinead. Oh, I'm not hearing any sound, Shanae. I think you have to like do the share. There's like a setting on the Teams meeting where you can share sound. If you go to like the top bar, sorry, this happens to me too every time I do this video presentation.
You see a teen or adult suddenly collapse, it is important to act fast. Helping to save a life is easier than you might think. Just start hands-only CPR. The first step is to ask someone to call 911 and to get an AED, or call 911 yourself and put your phone on speaker mode so the operator can assist you. Then get directly over the victim. Put the heel of one hand in the center of the chest and put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push giving 100 to 120 compressions per minute, which is about the same tempo as the song Staying Alive, or the rate of music you're listening to right now. Let's hope you never have to use hands-only CPR, but know that CPR combined with using an AED provides the best chance of saving a life. If possible, use an AED every time you provide CPR. Again, if you see a teen or adult suddenly collapse, don't be afraid to start hands-only CPR. Remember, call 911 and ask someone to get an AED. Then push hard and fast in the center of the chest until the AED and help arrives. Your actions can help save a life.
Thanks, Shanae. Yeah, so you saw in that video, that was kind of the overview of how to do hands-only CPR. I know when I first got certified for CPR many years ago, we learned the standard 30 compressions, 2 breaths for adults and teens, but research has found over the years that actually just doing the compressions, the hands only, is super effective on adults and teens. So we're really trying to make people more comfortable and more aware of how to do that. And so when you register for Heart Walk, you'll get access to that video and you can send it through your Heart Walk HQ. And I think I had 2 slides left. Sorry, Shanae, just the 2, and then promise to be done. So how to get started. I know you guys are all excited now, want to jump on this train. So very first step is to get registered as a team. And then once you have your team page set up, members can join, invite others, and spread the word. Step 2, you want to make it visible. Don't be shy after you get registered. Recruit 2 to 3 colleagues, family, or friends to join. People you'll find are usually very, they're wanting to get involved. They're wanting to help with a mission like this. Step 3, jumpstart fundraising. Encourage everyone you know to make a small personal donation when they register. Again, it just shows leadership by example to do so. And then use the app. We know that walkers who are using the app are raising on average 3 times more, which is incredible. And then finally, of course, celebrate your progress. Take time to celebrate milestones along the way, whether it's your first 5 walkers recruited or first $50 raised or a story of community impact. This is really meant to be like a fun event. And then my last slide here. So yeah, I know this is my closing here, but I just wanted to say, your group is already doing such amazing work to make healthy eating and active living a reality in PG County. And I think the Heart Way could just be a fun way to extend that, show your leadership, bring people together, and connect with thousands of other people who are connected to the same mission in our region. Like I said, the walk is free. It's completely family friendly. It's happening on Saturday, November 1st at the National Mall. And if you decide to form a team, I can make sure you have all the tools you need to get started. But even just showing up, taking that first step can make a big difference. So we'd love to see you guys there. And thanks so much for your time. And I'm happy to take if there's any questions now. If my email is there on that final slide. So if you'd like to connect later, feel free to reach out to me via email and I'm happy to chat.
Thank you so much, Heather. This was great. Sorry about the slide hiccup there. I couldn't advance past the video, so I
It
had
always,
to disconnect.
like I told you, it's always a thing, but I love showing the
always
video, so I'm willing to
something.
do it. Yes.
Thank you. Does anybody have any questions for Heather? This was great. All right. Well, hearing none, thank you again, Heather, and thank you for providing your email. I will be sure to share that in our follow-up correspondence as well. I always send a copy of the video as well as a copy of the slides, so we'll make sure our partners have that who are with us today, and those who couldn't join, we'll make sure they get that as well, in addition to your email. So if anyone has any questions, they can reach out to you. And I see a comment from Kate. Thank you, Heather. Team Suburban will be there on November
amazing.
1st.
That's so great. I'm happy to hear that. Yeah, I know some people are already registered under different hospitals and other groups, but that's amazing. Love to see that.
Awesome.
Okay.
Well,
I
thank
have to
you
jump to
so
another
much, Heather.
call, but yeah, thank you guys so much for having me. And like I said, don't hesitate to reach out to me if you have any questions you think of later or you want to get registered and you need help. I am happy to help.
Thank you so much. We appreciate your time.
Thank you. Bye, everyone.
Bye-bye. All right. Right. Well, that was wonderful. And now we're going to transition to some work group updates. I'm going to ask the amazing Taylor Palmer to share with us briefly about some important legislative updates and gather some feedback from us as well. So, Taylor?
Alrighty, well, good afternoon, everyone. Happy Wednesday. Happy fall on the horizon. Hope everyone is doing well. Wanted to hop back onto the work group to give you all a few updates. The last time we spoke, we talked about all the different initiatives that are going on across Prince George's County that are and are not legislatively mandated. So one of the updates that we have for you all involves Senate Bill 151 that was passed by the Maryland General Assembly in 2024 to establish a health and wellness work group in Prince George's County. The state was very specific in those they wanted to see represented within the work group. So there are nonprofit leaders, we have a county council member, we have a farmer, we have folks from all different stratospheres of the health and wellness world. And so we are developing a report, and I can put the legislation here in the chat that goes a little bit more specific in the report. But essentially, that report is going to be a really quick environmental scan of various health and wellness initiatives that we have in the county, also paired with best practices, and ultimately an identification of gaps and future recommendations for improving overall health and well-being here in Prince George's County. So with that being said, we could use the work group's assistance. Today's discussion was very much around the active living component of this work group, something that we don't often get to talk about a whole lot. I know a lot of times we talk a lot about the healthy eating portion of the HEAL work group. And so I wanted to open up space today to have a quick discussion with you all about active living to see, what resources are you all uplifting? Where are the gaps? Where are the barriers? What recommendations ultimately you have to improve active living in Prince George's County? So first, if we could advance the slide, I do have some data that I wanted to center us in. So Heather she gave some brief stats there at the beginning of her presentation regarding the poor health and wellness that we see here in Prince George's County, the elevated rates of obesity, of diabetes, of chronic disease. And I wanted to uplift this for our discussion today. So according to the Behavioral Risk Factor Surveillance System, BRFIS, many of you all may be familiar with, 1 in 2 Prince George's County residents reported that they are insufficiently active or inactive in 2023. That's a big deal. That's over 50% of our county is stating that they are insufficiently or inactive. And so with that, there comes a need for us to start to have these conversations of what's going well, what isn't going so well, what can we do better, and where do we go from this? How do we make sure that government agencies are partnering with community? How do we make sure that we're bringing in nonprofits? How do we make sure that ultimately we are all on the same page when it comes to active living, and are able to make unified recommendations moving forward? So with that being said, I wanted to open up the floor today. I have a few questions that I'd like to ask you all. So first, if you wouldn't mind, you feel free to use the chat function or come off of mute. So first question is, what active living programs does your organization manage, or which programs does your organization refer clients to in Prince George's County? I'm just going to start. I'm looking at the folks that we have in the room. We have a few different perspectives in the room with us. So, Joyce, curious from Adventus, do you all, off the top of your head, do you know if you refer patients to any active living programs in Prince George's County or in the other counties that you manage?
I am still working with that group and learning all of the resources that we are managing. I know that they are very limited in resources, so I will not be able to give it to you at this moment. I have to kind of look it up. So, but I can get that information out. We do have a resource that I can reach out to.
Thank you so much.
I see a comment from Kate McGrail. Suburban Hospital offers 3 fitness classes per week for older adults, in person at Gwen Britt, in person in Langley Park, and a virtual option. 2 of the classes are 2 times a week, and 1 is once a week. All classes are free to the participant.
Thank you for that, Kate.
Hey, Taylor, I just wanted to chime in. This is Devin from Health and Wellness from Prince George's County Parks and Recreation. We are actually, we can't say that we are really offering it to patients or clients, but we have a Step It Up program that's going on this evening that's in partnership with the Prince George's County Health Department. And we do have several outdoor classes that are free or very low cost that we offer throughout. Oh, thank you for putting that up, the flyer in the chat. So yeah, but we are having like a step challenge. We did that in partnership with you all to just really encourage people just to come out and move in their community and just become more familiar with some of the parks and park spaces. So I just wanted to mention that. I can also mention our Walktober event. This is something that is a monthly observance that is going to take place throughout the month of October, and also our, just while we're thinking about all of these great programs, our mental health awareness week is also taking place soon. So I can pop all of those flyers in the chat as well for those other programs, but just opportunities for people to come out free of cost so that they can yes, be active and take part in some of these great resources. And they have these opportunities to come out in different parts of the county. So it's very accessible for everyone. So just wanted to mention that.
Thank you so much, Devin. I've received so many presentations this week from Parks and Rec, and at each one I learned something new, and that just speaks to the volume of work that you all are all doing. So thank you so much for everything that you do over in the health and wellness team.
Since there's another comment from Kate, we also partner with Parks and Health Department and UMDCRH for Dine, Learn, and Move, which has a physical activity component. It is a free virtual event monthly. Joyce says behavioral health and wellness services provides telemental health at Fort Washington Medical Center at Adventist.
Love it. And I'm curious for Jessica. So we heard from the American Heart Association, this wonderful walk I'm already organizing, trying to organize with my friends to get there to DC, get to DC. I'm curious, for the American Heart Association,
Mhm.
what resources do you all track? Where do you find local level resources? I know you're trying to break through more in Prince George's County. What does that process look like on the active living side for American Heart Association?
I mean, not really. I mean, as you probably know, Taylor, not really kind of like as far as when it comes to like active living, probably just more not really kind of direct services like I know a lot of these other organizations. But I would say that's definitely an area that we could definitely probably like work more towards. I think a lot of our focus, as far as when we're talking about looking at the policy systems and environmental lens, has been more around like improving like healthier eating outcomes and things like that. But I definitely think that like this is definitely something that's on our radar and what we can do because we always are talking about improving the environment. I know that is one of the barriers that, especially when we're talking about Prince George's County, like it's not for the lack of like it's like sometimes it can be an accessibility, you know. So I definitely this is something that I think has definitely been on our radar. I know one of the areas on our more on an advocacy standpoint that was around kind of work where we are as far as maybe improving more areas around when we're talking about equitable as far as maybe like transportation, as far as like what can we do when we're talking about improving bike lanes and things of that nature, but not really direct around like physical activity. So this is something that I really feel that we definitely would love to learn more about and to see how we can, be a partner and what we can do as far as maybe more of an advocacy standpoint, what we can do to work alongside other organizations with.
Absolutely. I appreciate you
Mhm.
mentioning that, Jessica, because that really is the piece of when we talk about accessibility and availability. You
Yeah.
can have the resources available, but the accessibility, that's not always implied. And so that's where I think, especially with this work group, really making sure that we're advocating for the accessibility of any resources that exist. And I see Devin here has put some flyers in the chat. So encourage everyone take a look at those upcoming activities and advertise far and wide with your networks. Really great opportunities for any Prince George's County residents. Anyone else have any programs that their organization is overseeing, or as Jessica was just describing, maybe your organization isn't the one organizing, but having to refer clients to? Anyone have any experience with that? Anything they want to add?
All right, it says at Food and Friends, most of our clients are dealing with serious illnesses that may restrict their fitness abilities, but our nutrition team works with clients on a one-on-one basis to develop health goals. That said, we've changed our fall fundraiser from a pie selling event, which I love pie, to a move for meals to promote fitness goals. And she included the link. That's great.
Yeah, I love that. And, that's another prime example of, an organization who is working on really this the food as medicine scale, looking at those medically tailored meals and how to partner that active living piece with those programs, making sure that they're including those in the programming as well, and working with, it might be an elderly population or a population with disabilities that may inhibit them from being able to be physically active. So appreciate that insight. I am curious, opening it up to the group. If your organization is ever looking to promote an active living opportunity, where do you go for that information, specifically for resources here in Prince George's County? Does that magical unicorn exist? Are folks familiar with Parks and Rec navigating their site and how to book and schedule classes? Seeing some thumbs up. All right. Well, I will go ahead and move us to our last question here. Curious from the group, how can we enhance active living in Prince George's County? So you just heard Jessica, she mentioned more of helping to, with the advocacy piece to uplift these initiatives. Any other ideas about how to enhance active living in Prince George's County?
You guys have any more data on regarding like which age groups, genders, race, ethnicities? Or did I miss that? Are we talking all adults?
Yeah, I just pulled this quick statistic, so I don't have the in-depth data that looks at it by demographic. We can certainly continue this discussion and look at those specific subpopulations if you'd like.
I was just curious. I know we're going to continue to commit to the older adults, so.
Yeah, thanks for that, Kate. Anyone else working with a specific subpopulation that they'd like to mention?
I do just kind of want to, I know Kate mentioned that she's working with the older adult population. Jessica mentioned briefly about people living with disabilities and just making sure that we are making, that we have resources that are accessible and accommodating. And also just for our little ones. Like I think often when we hear about fitness and movement, it almost becomes burdensome because we think like, oh, we have to exercise and we have to do it, so many times, so many minutes a day and so many days a week, but just making it a fun activity, like just reminding people that, you don't necessarily have to go to the gym to get, to get movement in or to be physically active. But if you just go outside and walk your dog, or you go throw a ball with your neighborhood friends or the kids at the park, like that is still movement and all of that counts. So I think just making sure that we're, prioritizing populations that are often overlooked, but also shifting our messaging in a sense where it's more fun and more inclusive, and a part of everyday living versus something else that we have to take time out of our already busy schedules and our already expensive lives to pay for and to make time for. I think people would be more open to that kind of messaging instead. And I think I also see some additional resources in the chat. So thank you, Devin, for sharing that. Deborah says birth respondents are adults 18 and older. So thank you, Deborah.
Yeah, thank you, Deborah, my epidemiologist saving the day there. But yeah, I appreciate you mentioning that, Shanae, talking about really focusing on the entire family unit and, acknowledging that that's naturally how folks may spend time together is as a family. And so how can we incorporate that at every age and every stage? And then I'm
Another
seeing
comment
Jessica.
from Jessica. AHA does have tons of resources on the benefits of physical activity and how we can get exercise without having to get a gym membership. Thank you, Jessica.
Great. Alrighty. Well, any other facilitators or barriers to active living that you all want to raise today? All right, well, now that I've introduced the questions, I will go ahead and put my email in the chat. If you have any thoughts, if you want to hear more about that work group that I was just describing, please feel free to connect. If you want to touch base more about your organization and see how we can get you connected to active living resources, also happy to facilitate some connections there. So thank you everyone for your time, and thank you, Shanae, for room on the agenda.
Thank you, Taylor. We appreciate you as always. I know we have about 10 and 12 minutes left, so I'm going to share some community announcements, many of which were actually shared in the chat. So feel free to reference that as well for some of the flyers, and I will make sure to share those out with the follow-up email as well. But to get us started, MedStar Health Diabetes Support Group, they're launching a safe space to support individuals and families affected by diabetes, to essentially promote healthy coping strategies, to enhance self-management of diabetes, and to really just foster and help build meaningful relationships with other support group members as well as your healthcare provider. They will be meeting every third Wednesday of the month starting at 11 a.m. So if you are interested or know someone who may benefit from being a part of this support group, we ask that you share this resource. We continue to share the Park and Rec's Fall Guide, just another great resource to extend to our community residents for some of the programs, classes, and other resources available to support their overall health and well-being. The link is provided. Devin mentioned some of the other Parks and Recs activities going on. They are celebrating their Walktober for the month of October. So a lot of events for all ages that our fellow Prince Georgians can attend to get moving. So you can visit their website or check out the flyer, which she did include in the chat. It's also on this slide. So a lot of events coming up that they're sponsoring. So please feel free to participate and get moving. Parks and Recs is also observing Mental Health Awareness Weeks, which will be October 5th through the 11th. So again, you can visit their website to learn more about some of the mental health resources in Prince George's County and to learn how to better take care of your mental well-being. So there's going to be some free workshops, some training, some fitness classes. Again, lots going on this month, lots going on for the fall season. So feel free to participate. That flyer was also shared in the chat. So thank you for that, Devin. There was mention, I think Taylor included this in the chat, so Step It Up on Walk Maryland Day. So there are, I think it's today actually, yes, at 4 o'clock. Yes, wow, oh my gosh, because it's October, I keep forgetting. So yes, you can join them today at 4 o'clock in Fort Washington at the Tucker Road Athletic Complex. There's going to be some line dancing as well as their guided walk. So you can join in some fitness today, bring some friends and family. Girl Group is going to be hosted by Presley Counseling and Wellness. They're going to offer a safe and supportive space for young girls to build confidence, resilience, and connection. They're going to have guided discussions and activities. This will be this Saturday at 12:30 in Fort Washington. So I will make sure you all have this flyer as well. Medicare open enrollment is next week, hosted by Prince George's County State Health Insurance Program. It's just an opportunity for people to learn more about their Medicare benefits, how to complete a benefits checkup, receive one-on-one assistance, and to learn some ways to save on healthcare costs. So this event is next Friday at 10 a.m. at the Health and Human Services Building, Capitol Hill. The Johns Hopkins University Bloomberg School of Public Health is seeking to speak with Black Medicare beneficiaries in a 30-minute phone interview, really just to understand what influenced their health plan selection. So if you or someone you know might be interested in participating, please feel free to share this flyer with them. There will also be a $25 gift card incentive available to those who participate as well. Towards the end of the month, Therapeutic Links is going to honor National Substance Abuse Prevention Month with their One Future, One Voice Youth and Prevention Town Hall. That will be Saturday, October 25th at 10 a.m. This event aims to bring youth, families, and prevention partners together for an interactive day of learning. There will be some dialogue, some conversation, and some community connection. So they're going to have informational tables. There's a youth-led town hall discussion, as well as other family-friendly elements. So they're going to have raffles and giveaways and some other interactive activities. So if you're interested, you can email the web address at the bottom of this slide, and I'll make sure you all have this as well. And we just had our wonderful presentation on the DC Heart Walk. So again, just a friendly reminder that Saturday, November 1st, you can join them at the National Mall for their 1 to 3 mile walk. Bring your pets, bring your kids, bring your family and friends, your coworkers, and participate in this exceptional event. So we hope to see you all there November 1st. And then finally, The health department is hosting their virtual diabetes self-management program starting November 3rd. They're going to meet every Monday online at 4 p.m. So if you or someone you know is living with prediabetes or type 2 diabetes, please consider registering them for this free class or this cohort, and they will really just work with their cohort to learn ways to better live with and manage diabetes. And I think they're also going to do some action plan creation and practicing. And Taylor, I don't know if you want to speak a little bit more to this. You're welcome to do so.
Yeah, absolutely. Thank you, Shanae. So, as Shanae mentioned, the health department is going to be hosting its a 6-week series. It's going to be 6-week series. It's going to be virtual on Mondays from 4 to 6:30 p.m. This is a diabetes self-management program. Folks who are eligible are caretakers, anyone who is pre-diabetic or living with diabetes. It's going to be a wonderful opportunity to get to come together and create some health goals and be able to learn some better management techniques. So if you are interested, feel free to join us, and we will also have a pre-session that you can come and you can learn more about the program a week before the class starts. So I'm going to put the picture of the flyer in the chat if you can share it with your networks.
Awesome. Thank you, Taylor. And to note, registration is required because there's limited space. So make sure you register if you are interested. And Taylor, if that does start to get a little bit full, let us know so we can inform our partners as well. Are there any additional announcements?
I do see our student Jenna is from University of Maryland. She's joined us today. Jenna, would you like to make your community announcement?
Yes, I was just typing something up in the chat. Sorry, my internet's been buggy all day, so I can't quite come off camera. But I am a PhD student at the University of Maryland College Park School of Public Health. And right now I am a graduate research assistant with Dr. Sylvette Latouche Howard and Dr. Tracy Ziegler. And we are currently in development of a community-based simulation to help teach students more about how healthcare interventions can affect communities on broad scales. To create this kind of simulation, we need a lot of data about health behavior and how people think about healthcare. And so we're hoping to reach as many people in Prince George's County as we can. Oh, thank you for posting our flyer as well. So Taylor threw a flyer in the chat. So right now it's just a short 20-30 minute survey about personality and your opinions on and experiences with certain healthcare things. It's responses to a few healthcare and healthcare like campaigns, videos, images. Right now we're focusing really heavily on healthy active living and nutritious eating. So this is a perfect space for sharing this. It's open to all adults that live in Prince George's County, Maryland. So I greatly encourage you to take the survey, share it with others. We're using it to help create a tool for our students here to help foster a really strong and robust learning environment for our students. So that would be super appreciated if you could take that and share it. My email is on that flyer as well. If you have more questions about our project, I'd be happy to chat and share more about it. Yeah, so basically we're just trying to teach our students in a more responsible and ethical way about community responses without actually having to use community members as test subjects. So that would be really appreciated if you could take that, share that with your community members. We're collecting data throughout the next month or so, so that'd be fantastic.
Thank you so much for sharing. And I've been sending that out to the other work groups, so I'll make sure that I send that as well, the flyer out to our HEAL work group members as well. Any other community announcements? You're most welcome. All right, well, hearing none, I know that we typically meet bi-monthly. That would bring us to December. And I know that that is the holiday season. We also have our community health improvement plan coming up with a lot going on. It's going to be a lot of work. And so we might have to meet kind of on like an off day. But I will make sure to send that correspondence out to you all so we can plan accordingly if that is the case. So a date for our next meeting is to be determined. But if you all have any questions in the meantime, please feel free to send me an email. And I look forward to seeing you all very, very soon. Enjoy the rest of your your week. Thanks, everyone.
Thanks, everyone.